presentation as well. All right. So I won't be able to see you all, but hopefully you can see my screen.
We can see that. Thanks.
Thanks. All right, let's go ahead and get started. Like I said, my name is Karen Stahlberg, and I am an OBGYN and also a faculty member in the Department of Learning and Health Sciences, where the Health Infrastructures and Learning Systems online degree program is housed. And what we're going to talk about today is what is the degree, what are the requirements, and how might you apply? So the thing to realize is that this degree in health infrastructures and learning systems is actually the first of its kind. There is this joint emphasis on information and social science through a lens of organizational change. And the goal is to improve the health of individuals as well as populations and even systems. What's novel about this is because of the combination of informatics and analytics, but also implementation science, individuals are able to learn the skills to create innovative system solutions that are going to improve health and health equity. The other thing that's nice about this degree is that it's flexible. So you can complete the degree in 1 year as a full-time student or 2 to 3 years as a part-time student. And because there are really only a few times when you need to be in person in Ann Arbor, it's a great way for you to remain in your current work position, location, etc. So just a quick sort of history about how did learning health systems, this whole idea, come about, and how did we develop this program? So the Agency for Healthcare Research and Quality, also known as AHRQ, basically talked about what are the competencies within a learning health system that people who are experts in this field would need to have. So we need a culture of continuous learning that gathers and applies evidence in real time to guide care. We're going to use IT, so technology to share new evidence and improve decision making. The other key component is that patients are a vital member of the learning team and should be included in all of the decisions. We want to make sure there's a way to capture and analyze data and care experiences. And then the key here is to create that feedback loop for learning and improvement. So this learning cycle is really the work of a learning health system. There's the formation of a learning community around a health problem of interest that requires performance to data to be collected. That data is then analyzed and understood to create new evidence-based knowledge. And then interventions are crafted to take that new knowledge and implement it back into the system and create that loop all over again. So if you think about infrastructures, we also need the technology and the processes for supporting learning communities. We need shared technology for analyzing data. We need policy and ethics for data, as well as technology promoted change. So our HILS students, and there are actually 3 HILS degrees, believe it or not. There's a PhD program, there is a Master's of Science residential program, and a Master's of Science online degree program. And so right now what we're talking about is the online degree program, but as you can see, our HILS students sort of hail from all over the world, and especially in the United States. Right now, the degree program is limited to United States residents and citizens. We are working to open that up. And as soon as we have more information about being open to international students, we will absolutely distribute that. Our current HILS students, though, have a diverse educational background. Obviously, there's the folks in health sciences, there's folks in information and computing, individuals with expertise and interest in organizational change and policy sciences, folks with behavioral and social sciences, and engineers. So this is our current cohort in fall of 22. I like to refer to them as Team 2 because we are a very brand new online degree program, and this is the second group of individuals who have joined us. We have a few physicians who are interested in surgical innovation, adolescent substance use treatment. We have a number of nurses who are focused on pre-hospital care and out-of-hospital care. We have someone focused on cystic fibrosis and how that can be improved and the care around that. We have a technical business analyst who lives on the data side of things and understanding the impact that data can have, its interoperability, and then a few medical students who are actually doing a gap year to think about how might the sciences engaged in a learning health system help them provide better care, both globally as well as within healthcare records. So the one thing that's really important to know is that our HILS online degree program is all online. And so much like our health sciences library has no books in it, you actually don't have to come and sit in class. But you do have to complete 27 credit hours and complete a learning cycle project. And at the end of that, you will obtain a Master of Science degree from the University of Michigan Medical School. The degree is meant to give you specialized training to make lasting improvements. And the goal here is for you to stay where you are and to work in your healthcare environment or your current area of expertise. The courses are all offered asynchronously. What that means is that you do not show up for class at a certain time. It means that the information is released to you week by week, and you engage with the material, you answer questions, you may be involved in synchronous class projects. So sometimes negotiating time zones can be difficult, but our colleagues are making it work. All of the content is through the Canvas learning management system, and you're able to sort of review the material, interact with it at your own pace and space. I do want you to remember, though, that this is a full master's degree program, 3 credit courses each from the University of Michigan Medical School. And so you should expect to work about 8 to 10 hours per week per course. So that's just an important sort of norm set because a lot of people think, oh, I can like work full time and do all of this. And we like to caution you that that may not work as well. So for folks who are curious, well, what does it mean to take an online course or a degree program? What are the sort of content that you're teaching? One of our colleagues, Vinod Vidaswaran, actually has a couple of courses on Coursera, on the Coursera platform. This one is called Information Extraction from Free Text Data and Health. So how can you take free text in the electronic health record and understand it, query it, make conclusions about care or treatments or what have you. If you are affiliated with the University of Michigan, this is a free option. You can either audit or obtain a certificate. Those outside of the University of Michigan can also audit for free. Basically, what this course will give you is this advanced machine learning and natural language processing techniques to really think about healthcare data. So sorry about that. So the HILS online degree program, like I said, is all asynchronous and all online. And this is what it looks like when you enter the Canvas site. So the course structures are built within this system, this learning management system. There's introductory videos, recorded lectures, overviews of the modules, of course, reading assignments, class discussions, papers, quizzes, all of the things that make up a degree program. We also want you to complete a learning cycle project capstone before you finish your degree. And this is really meant to apply the information that you're learning into a real world context so that once you've completed your degree, you've had this experience of making what we call a learning cycle loop work. So in the fall term, your first term, you'll think about, what are the topics that have you interested, maybe talk with your advisor about how do we structure a learning cycle project. In the winter term, we'll think about refining the project proposal and preparing for the project, which will happen in the spring-summer term. When you're doing your learning cycle project, you also will be taking the 3-credit course, LHS 622, which I actually teach. And you'll be able to not only learn the material, but also execute your project, reflect on your experiences, and share best practices with one another. So one of the examples of the learning cycle project, and I think I grabbed the wrong slide, but that's okay, is illustrated here, Rama Minwesi is one of actually our HILS PhD graduates who's now faculty. And when he was doing his project, he was working in the operating rooms, looking at quality and looking at patterns in surgical count related incident reporting behaviors to avoid retained surgical instruments. And so his study was all about, well, why are we not getting the data that we need, right? There should be no retained surgical instruments. And if people are reporting the counts correctly, then there shouldn't be a problem. So what are the barriers to reporting? And as you can see there, so it's time pressure, it's lack of feedback, it's uncertainty, and it's also the usability of the form that people are using. Catherine Irwin, who's one of our graduates, said that the HILS core curriculum offered a comprehensive but practical framework. And so she really found value because she used that framework across the whole range of topics that are part of the cycle. The HRQ Learning Health Systems researcher competencies also helped form the scaffold or backbone for this degree program. And as we build the workforce, we want people who graduate from this program to become leaders and to know about the ethics of research and implementation in health systems, to think about healthcare equity and justice, improvement and implementation science, informatics, research methods, the standards of scientific evidence, and of course, system science. And so to do that, we actually designed the curriculum to go around the entire learning cycle and touch on all of those points that AHRQ demonstrated as pertinent for becoming a learning health system. So we have information about healthcare data for decision-making, policy and ethics for data use, shared knowledge for improvement, like I said, implementation science, and technology-promoted change. So let's look a little bit at the courses that you'll have. So in the center there is Dr. Gretchen Pyatt, who is the associate chair in the department, as well as the graduate chair for the HILS program. To her right is Rama Munyesi, whose project I just showed you. And our courses are divided into health infrastructures and policy domains, implementation science domains, data science, which is, how is data used? How is it structured? How do we understand it? What are the informatics that are involved? As well as research methods. This actually is a picture from cohort 1. That's Dr. Chuck Friedman, who's the chair of the Department of Learning Health Sciences and really an international leader in learning health systems. And he teaches one of our courses. So speaking of courses, this is what it would look like if you did the one-year plan. You would basically be done in about 12 to 14 months. Fall semesters here at the University of Michigan start the end of August and go into the middle of December. Winter terms start sort of middle of January and will go into late April, May. And then spring, summer goes May through August. If you take four courses, 3 credits each for 2 semesters, that will get you to the final semester, which is a 3-credit course in that capstone project. For individuals who need to spread this out a little further, we actually can do that. None of the courses are necessarily predicated on the others. However, the courses are only offered in certain semesters. So if you don't take all of the courses in your first semester, then you would have to wait till the following fall to take the other 2. And that's how this gets spread out to about 18 months or so. We do have class institutes that require that you come to campus, and we'll talk more about that in just a minute. So the institutes are required, and they're meant to reinforce current coursework. You spend about 2 to 3 days on campus in active learning sessions with getting skill development, dedicated one-on-one mentoring, and definitely socialization, because when you spend a lot of time with one another in a virtual environment, it's actually very great to come together with your cohort and meet each other in person, as well as meet and interact with the other HILS faculty and community members. This actually is a picture of the orientation that we do in August, which is the kickoff for your first institute. So the goal here when you finish the degree is to lead, change, and transform health, to think about quality and safety and the management of health initiatives, and using your expertise in informatics and data analytics to really be an improvement and implementation leader. I wanted to just give you just sort of a 20,000 foot view of all of the things that are happening here at the University of Michigan in terms of components of learning health system. So we have artificial intelligence work going on. We have precision health work. We have large data warehouses. The VA has a learning support system called Query. We actually have a real-time center that is working on operations, thinking about safety and quality. So when you come to the University of Michigan to work in a learning health system, we have all of our faculty working in all of these systems, and definitely ways to connect you either here or in your own environment. So what type of careers do people end up with? Well, it's sort of all over the board. It could be informatics, it could be improvement and quality, it could be ethics and policy, it could be individuals who are really making change in their own institution and creating sort of this movement around learning health sciences. Our graduates now are kind of all over the place, really, which is great. Some have remained here as PhD candidates, so beware, but most have left and have gone on to become data architects. We have a few who became their own entrepreneurs and have opened a management consulting firm. We have a clinical research coordinators, clinical lecturers, and folks who have gone back to their own organizations to help them become a learning health system. So Angie, I think this is where I turn it over to you. I do see that there are questions in the chat, which we'll get to after this presentation. So keep those questions coming because we'll be sure to answer them. So Angie, I'm going to turn it over to you.
All right, great. Thank you, Dr. Stolberg. So I'm going to cover a few of the student services side of things to begin with advising. So students are paired with a faculty advisor who will have live office hours. Typically, those are via Zoom, or you can contact them via email. I did want to note that you're going to be taught and mentored by the same faculty who teach in the residential program. So for example, pictured here is Dr. Rachel Richardson at our HILS Online orientation session last year. And she's a professor in our department and conducts research on the quality and usability of data from electronic health records. So here she's advising a HILS Online learner who has an interest in learning health systems to improve patient outcomes. And you'll also have easy access to me as a program manager through email, individual Zoom meetings, the HILS Online community page, and Canvas. So there are a variety of ways to get in contact with me and Dr. Stolberg. And the one thing that I did want to point out is that even though this is an online program, you will be supported by real people such as myself, Dr. Stolberg, and other faculty, as we truly want to give you a full learning experience as a Michigan student. So being a student in our online program, you'll have access to an abundant variety of student support services, such as Rackham Graduate School, which has student communities such as students with children, students with disabilities, LGBTQ plus students, health and well-being resources. There's also in the medical school is the Office of Graduate and Postdoctoral Studies, and it overlaps somewhat with what Rackham offers for resources such as health and wellness, diversity, equity, and inclusion resources. And you'll have also access to other university resources such as counseling and psychological services, Taubman Health Sciences Library, in addition to all libraries on campus. And listed here are just a few of those resources. So you can see there's an abundant variety of student support services for our online students. So tuition information is based on the 2022-2023 academic year. So please note that tuition and fees often change each year. So again, these are based on this year. So typically a student is going to take between 6 to 12 credits, 6 credits being part-time, 9 credits or more is considered full-time. So for example, if you're a part-time Michigan resident, tuition is $8,567. And if you're a non-resident taking 6 credits, which is part-time, it's $17,333. For full-time, which is 9 credits or more, tuition is $12,758 for Michigan residents, and then it's $25,907 for a non-resident. And there are also mandatory fees assessed each term, as you'll see here, such as central student government fee, registration fee, et cetera, for a total of around $166. So we wanted to break it down for you even further. So if you were to complete the program in 1 year, this is what it would look like. As a Michigan resident, that first semester in the fall is $12,758. It's the same for the winter term, $12,758. And then for spring and summer, it's $4,376. And this is going to give you an estimated total of around $29,892. And then as a non-Michigan resident, that fall semester is $25,907. The winter term is $25,907, and then the spring summer term is $8,759. And that's going to give you an estimated total of around $60,573. And again, this is based on this year, 2022-2023 data, and that is subject to change. And then some additional expenses or technology needs to consider are study materials such as books, notebooks, and note that many of our textbooks are available for free online or via the Michigan Library. High-speed internet service is highly recommended, computer equipment and software. What's recommended university-wide is a webcam, a RAM of 4 gigabytes, a microphone, headphones, compatible browsers. And then additional expenses will be for travel expenses, like Dr. Stolberg mentioned. Students will be required to attend in-person institute sessions 3 times throughout their time in the program. So if you live and work in Michigan, this likely won't be much of an issue for you. And then for the application requirements, we require a bachelor's degree with 1 statistics class, personal and academic statement of purpose, and I'll go into more detail on this in a few minutes, resume, CV, transcripts, 3 letters of recommendation. And for those letters, you'll want to choose people who know you well, those that can provide an evaluation of your ability to perform and succeed at the graduate level. And often that might be a manager or supervisor from school or work. If possible, include at least 1 letter from a past or current professor, advisor, or someone who has supervised you in a job or internship. And I wanted to note that the GRE is no longer required for admission. And now I'll review some tips for your statement, starting with the academic statement. And this is where you'll want to discuss your primary research area of interest. You'll want to reach out to potential advisors, 2 to 3 HILS faculty to introduce yourself and discuss the potential fit to our program. Faculty are aware that interested applicants reach out to them, so don't feel strange sending them a cold email introducing yourself. And you'll want to do this before you complete your academic statement of purpose. And you can read about each of our faculty on our website and choose those that are perhaps doing research or teach an area of interest to you. In the academic statement, you'll want to explain why you identified the potential advisors you did and interactions you had with them. In addition, you'll want to describe your understanding of learning health systems and what interests you about them. And if applicable, describe any prior research experiences or courses or projects that have prepared you for graduate study. And all this is covered on the actual application, so you don't need to remember it right now. And then for your personal statement, this is different from your academic, and this is where you get the opportunity to explain how your background and life experiences, other opportunities or challenges motivated your decision to pursue a graduate degree at the University of Michigan. And I wanted to note that if you're a current Rackham student, you completed your personal statement when you applied to Rackham, so you won't be required to write another one. And then for non-Rackham students, you'll want your personal statement to be more of a discussion of your journey that has led your decision to seek a graduate degree. So you want to make sure that you don't repeat your academic statement of purpose here. And then we have some resources on learning health systems that can help with your application as you write that academic statement. And I'll send this to you in an email after the session, and in addition to the other information that we discussed today. So to begin with, we have a couple of journal articles. The first one, Development of the Learning Health System Research Core Competencies, which discusses how the core competencies for learning health systems were developed. And next is a journal article written by the chair of the department, Dr. Chuck Friedman, who you saw in an earlier slide, and Josh Rubin, who is a program officer in our department. And that journal is Weaving Together a Healthcare Improvement Tapestry, Learning Health Systems Brings Together Health IT Data, stakeholders to share knowledge and improve health. So be sure to check that one out. And in addition, a website link to the Learning Health Systems Open Access Journal. And this is an open access journal that is freely available to read and download. And then last is the Agency for Healthcare Research and Quality Learning Health Systems website. And this is an agency that funds LHS researchers. And you can go here to learn about different types of research that is funded by the agency. So again, I'll be sending you all these resources. And then some application tips. Please be sure to proofread your statement carefully, ask a friend, a colleague, a mentor to also review it, paying special attention to typographical errors, grammar, overall punctuality and or clarity, and submit all materials in a timely manner to prevent the delay in reviewing your application. And how to apply. So since we are a Rackham program, you will apply through the Rackham Graduate School website. You'll complete their online application found on their website. Our website links directly to the application as well. On the site, you can upload all materials in addition to sending them directly to us if you need to. We have 2 deadlines. February 1 was our first deadline to apply for merit-based scholarships. However, since that has passed, our final deadline to apply is June 1. And there are fees to apply, $10 if you're a Rackham student, $75 for non-Rackham applicants. And then we have fee waivers available. So reach out to me if you're interested in obtaining a fee waiver. And then the application timeline, we aim to notify applicants 6 to 8 weeks after receipt of the application. So again, get those applications into us early. And then we get questions about transfer credit. At this time, we're not allowing credits to be transferred. However, if you've taken a course that is equivalent to a required course for the program, we may be able to review options for substitute electives or other course options. And then last, this is our contact information along with our website. You can find a lot of information on the website, what we just covered. In addition, feel free to reach out to Dr. Stahlberg or myself at any time with questions. So at this time, we'd like to thank you for your attention and open it up for questions.
Thanks, Nancy. Looks like, let me make sure we've got the questions in the chat. So one is, if somebody doesn't have experience in healthcare, should you apply for the program or would you need 2 or 3 years of experience? You know, I think that's a complicated question, but the truth of the matter is that the content is really grounded in healthcare systems. And so a good understanding or experience of what happens in the healthcare system would be important. Much like MBA programs have folks work a couple of years before they go into an MBA program. I think people will get the most out of this program if they already have an understanding of a healthcare system. Now, it could be that people are thinking about applying to medical school or pharmacy school and have worked in a healthcare environment. You know, that sort of counts, if you will, if that makes sense. And there's some, we can go through that question a little bit more if you'd like. Is the on-campus requirement still applied to those who work full-time? Jordan, yes. We do have those 2 to 3 day on-campus institutes basically in August and February, and then June again, or August, depending on how things work out. We try to make them so that they're at the beginning or the end of a week. But yes, that would be a requirement. And it looks like Angie had already answered that. So sorry, but wanted to explain it more. So let me pause there and ask for questions. Jordan, did you have additional questions?
Yeah. Hi, thanks for answering that. I have a follow-up question for that. Is it sort of during like a weekend or maybe like an afternoon time period? Just kind of curious about when you would be expected to be on campus.
Mm-hmm. Yep. So this past institute, we were here Sunday through Monday. So my expectation was that I think people traveled from out of town, arrived late Saturday and headed out Monday afternoon, later in the afternoon. Angie, do you want to? Yeah, it ends up being 2-3 days,
Yeah, and the one in the fall,
full days.
the one in the fall is usually tied in with our campus orientation, like the university in general, and that's usually on a Friday. So it would be like a Friday and a Saturday. That's what we've done in the past. So that's subject to change, but that's probably potentially what we might be doing again this fall semester.
Okay,
Yeah,
great.
but it's a full day.
Okay. I just have one more question for applying for 2024. So priority deadlines end February 1st. When does the application sort of open up? Is it like September? Like when can I expect to start that process?
Yes, that's right. It's around the around September 7th or so, that first second week of September, they will open up for the fall of 24.
Thank you.
Yes.
Absolutely. I wanted to make sure that Crystal Schramm, who is a current member of Team 2, got an opportunity to share her experience. Crystal, I wonder if you wouldn't mind just giving a brief introduction as to sort of where you are, what kind of work you get paid to do, and what you're interested in doing with HILS Online.
Yeah, you bet. Hi, let me just fix my camera. Thank you for having me. So I am a senior technical business analyst at the Michigan Health Information Network. It's known as MIHIN. It's the state designated health information exchange in Michigan. And I do all kinds of things with data and data quality and conformance. I also work on hooking up tribes to the health information exchange in Michigan, as I am a tribal descendant. And so that's been one of my passions I've been working on, which has really coupled nicely with being in this program, because many of my day job tasks and what I work on during the day really correlates nicely to the program and the classes that are in it. And I've met so many people in our group. We have somebody that's from Colorado, from Alaska. We have people from Michigan. We have a med student. It's a whole different mix of people. And so, yeah, I'm really getting to utilize what I'm doing in work and school and back and forth.
Thanks. And Crystal, are you working full-time or part-time?
I work full-time. So I am attending the HILS program part-time.
And what does part-time look like for you?
So part-time looks like for me, that's 2 classes per semester.
Great. And so how long do you think it will take you to complete the degree?
I'm hoping to be done in 2 years. So I'm, yep, yeah.
Fantastic. Other questions, either to us or to Crystal directly?
I have one, but before I start, thank you so much for the PowerPoint. It made a lot of things more clear. My only question is about research, and what do you require for research? Do we have to be involved in more of a like a big research? Do we have to have our own writings, or does school research going through school or writing paper count as a previous research experience? Thank you.
Yeah, absolutely. Great question. So in terms of like research experience, you don't necessarily have to have research experience, although we definitely require, knowledge of statistics and a scientific sort of eye, if you will. The projects within the courses are all, contained within the course. The expectation is not necessarily that you finish a big research project. That's not necessarily what the learning cycle project will be, although there may be research questions within there. The goal is for us to help you think about research, connect you with individuals who may be doing research that you are interested in, and sort of beginning that process. Sort of individual research, big research projects are usually what happens in a PhD program and not in a Master's of Science degree program.
Okay, thank you. I just got one more question. How can we get to the potential faculty advisors? How can we reach them? Is it on the main website of the program?
Okay, Angie, I'm gonna let you answer that one.
Yeah, sure. Yeah, it's on our main website. And when I send you information about our presentation today, it'll include a link in there to take you directly to our faculty. And like I was saying, they are used to students reaching out to them. So feel free to reach out to them. And if you have any issues contacting anyone or not getting a response, let me know and I can help with that.
Yeah, it's really about trying to find an advisor, somebody who is sort of interested in things that you're interested in as well. So Crystal, who are you working with and why?
So I'm working with Rachel Richardson. I think that's how you say her last name.
Mhm.
Yeah. And so she knew that I had an emphasis really working on data and kind of with my background. When I started, interviewing the faculty and they kind of understood my experiences, based on the work that she's done in her career with research and data, it made sense. It fit along the lines of, what I look at doing long-term with my work.
Yeah, thanks. Because she's sort of one of the experts in like data standards and data information. And one of the things that you do in your work is, which I benefit from as a clinician every day, thank you, Crystal, is bringing the healthcare information that's in the electronic health records from most of the systems in the state together to then distribute if needed. So if I see somebody who's not in our healthcare system here at Michigan Medicine, if they're on that same health information exchange network, I can often gather their charts from outside and their information from outside. Not everything, and not everybody's on the exchange, but for those who are, it's just a huge benefit. So thank you.
We try over at my end. Lots of work.
I know.
Yes.
I know. That's you guys. You have to tell your colleagues that, like, I know feel like we're slogging away, but there's actually people out there who care.
Yep. Yeah, we'll have to have you come on and do the testimonial at some point.
Happy to help. Absolutely. Other questions? Comments? Hi, Jennifer.
Thank you so much for this presentation. It's been very helpful and informational.
I saw the unmute, but I'm not hearing you. Sorry. You could type it if it's easier. All right, well, as follow-up of this session, because a noon session is right in the middle of everybody's workday. So we're very grateful that you're here and interested in the program. Like Angie said, she's going to distribute information and you can reach out to any of us directly. Please feel free to reach out to the faculty via email. They're expecting folks to have interest in the HILS Online degree program. And now I see Jennifer's question. Awesome. Statistics course required. Yes, it needs to be completed prior to admission. Angie, I'm going to let you handle that statistics course question.
Yeah, sure. We do require you to have it completed before you start. There are several online courses out there that are free to take that you could take. You can look at a community college somewhere local to you, something online if you would like. And I can send you a list of some suggested courses that we have if you would like me to do that. I will go ahead and take down your name and then I will go ahead and send you that information.
I have a quick follow-up question to that. When I was an undergrad, I took like a business statistics course, and would that count as well?
We'd have to see the curriculum or the syllabus to make sure that you've got the content that you need. And then of course it would be a matter of like timing. So Crystal, I don't remember, did you do a little statistics brush up or did you feel okay?
No, I think I was okay. And I hadn't taken a course in a while, but I also use statistics like in my job too. So
right.
Yeah.
I did take like a general statistics course and then a business stats course. So I took two. I just am not sure like what the transfer requirements. Like I went to Wayne State. I didn't go to U of M for undergrad, so I'm not totally sure like how but I did get a public health degree. So yeah, I'm just curious about that.
Yeah, it sounds like that would be right in your wheelhouse, and I don't know like that you'd need more in all
Okay,
honesty.
that's good.
Yeah.
Another
Yeah.
question I thought of was, is it recommended to sort of apply with a very specific sort of career goal in mind? Like I have a lot of interests in, I don't know, I'm wondering about the, I guess the best way to like get accepted into a program. Do they want you to have like a defined goal? If that makes sense.
So, I would say yes and no, right? So, obviously the domain of learning health systems and health infrastructure and data is very specific, implementation science, that kind of thing. But what most learners find is that they come into a program with an idea, and through engagement with the material and other classmates and faculty, that like their ideas about what they want to do shift. And so I would say that you don't have to have a specific like line of sight. There are other folks, like Crystal, who comes from a learning system already, if you will, and she's sort of leveling up. So, we really do holistic admissions. And so that's why the academic statement of purpose, as well as your personal statement, combined with sort of your understanding of a health, of a learning health system, and prior evidence of academic success, all kind of blend together to contribute to an admissions decision. Yeah.
Great, thank you.
Yeah, we really want a good mix of people, and what that means is people with a variety of like lines of sight to parts of the healthcare system, prior life experiences, expertise in certain domains. And so Crystal, spoke to that, which is we've got, nurses and data analysts and physicians and folks from industry also. So it's really meant to, just like we get a whole learning community around a health problem of interest, we want a big, wide, open community within the degree program as well.
Thank you.
Of course. Other thoughts or questions?
Jennifer did have a follow-up question about if she took statistics 5 to 7 years ago, would that still be valid? It would depend, right?
Go ahead.
No, go ahead, Karen.
No, I was gonna say it sort of depends, right? Like where you've obtained your degree, your comfort level with statistics. So I think, worst case scenario, when we've had this before, somebody has applied and we've said, we'd really love you in this program, and we think that you might benefit from a little sort of brush up on statistics, and here's some opportunities. But we haven't necessarily held up somebody's admission because of statistics. Like that would be that's no fun.
Yeah, because they use it in statistics in a couple of the courses, and I'm not remembering which ones.
Yeah, Crystal, sort of all of them, right?
Yeah, I feel like you kind of have to have a general breadth of knowledge as you're talking about the data.
Yep. It's like a language, sort of a language requirement, if you will. Numbers language.
Sure. Thank you so much for answering that. Can you hear me now?
Yes, definitely.
Okay, great. Thank you. No, that makes sense. I was just wondering if I work with data right now, so I think that I would probably be set with that. But I was just curious if there was a hard time frame that needed to be completed in. But thank you.
Yeah, no, and we have learners who have been out of a graduate school for 15 years and have come back to school. So it's really individualized. But no, it's not a deal breaker if it was 5 to 7 years ago and you use it every day. Definitely not. You'll be able to help your classmates. Cool. All right. Well, I think we're going to wrap this up. Crystal, thanks for being here. I know that she's doing 2 things at once. So she's probably going to bop out to go back to the
if and feel free to share my contact information, if they ever want to reach out to me or whatever, I'd love to do some kind of mentor program at some point.
Thank you. That's fantastic. We're going to take you up on that.
Yeah.
I was going to say the exact same thing. Thanks, Crystal.
Yeah, and we have it on tape.
Yeah.
Anyhow, so thanks again, Crystal. And so we'll keep an eye out for an email from Angie. If you have any additional questions or concerns, please reach out. Any clarifying information, if you're just not sure, let us know. And then Angie and I'll hang back just a little bit because sometimes folks want to talk one-on-one or not, do things in a big group. But we're going to pause the recording now and then